Today we are going to do the rotator cuff repair of this gentleman, and he is a young guy, and this injury happened while lifting some weight in the gym. And this is the marking, this is the spine of his scapula, and this is the posterior border of the acromion, and this is the anterior border. 2 centimeter down and medial is the posterior portal, and then we'll go for the feel the coracoid. Coracoid is just 4 centimeter down to the acromioclavicular joint, and just lateral to that you are going to make the anterior portal. And in the lateral portal, for the subacromial decompression on the posterior border of the clavicle, you have to make, we are 5 centimeter above the axillary nerve, so this area is very much safe. So now I'm going to give the incision, starting now. Some people are using the adrenaline with xylocaine. I don't prefer that. Binu is our assistant. He is very much expert. And this case I am doing in the beach position, and monitor is the front. So after putting the knife, we have to just separate the muscle with the artery, and then put the trocar. Just feel the coracoid first. Put one finger over the coracoid. Somebody has to give the traction if you don't have the Trimano, and just feel that. And now we are inside the joint. So now we'll see in the scope. Now I'll make the anterior portal by putting the spinal needle and putting the 8 mm port cannula. So after putting the cannula, I'll do the diagnostic arthroscopy, and you can see this is some degenerative changes in the anterior bank arch, and this is the axillary recess down, and this is the biceps, and this is the head of the humerus. And now I'm going to just put the saver to divide this degenerative. No need to repair this one. And you can see clearly this is the tear in the supraspinatus, just tear to the biceps. Now I'm going to debride this degenerative fiber. To make the smooth surface, and you can clearly see the tear in the supraspinatus. You can see this stent. This is like a crescent shaped tear. And after clearing the degenerative fiber of the rotator cuff, you can see this is the clear tear. And now I'm going to do the subacromial decompression, and for the repair, so we have to going to make the lateral portal. Now I'm going to, this is the bursal tissue on the undersurface of the acromion, which I'm going to debride it to expose the rotator cuff, and we can able to see the tear completely. And just I'm using some radio frequency ablation. Now this is the area where is the attachment of the rotator cuff, and you can see this my saver is directly exposing the rotator cuff tear, which you can see in the photographs, and my saver is already inside the rotator cuff. So now we have to prepare the bed for the repair. Just try to prepare the humeral surface of the rotator cuff, and after that we are going to put the one punch over this prepared bed, and then I am going to tap it till the black line, as you can see there, and the bone quality looks fine. So I am going to do the tapping, but sometimes if bone quality is not good, you can directly go for the putting the suture anchor. But here I am going to put the tap, and you can see the fat globules, means we are inside the marrow, and after putting the tap we are going to put the peak suture anchor, and this is the final picture after putting the anchor with 4 thread. And we are going to put one accessory portal after putting the spinal needle, and we'll put the 8 mm port cannula to retrieve all the suture fiber through this one. It will help in the easy settling of the fiber, and then we'll put the lasso to take the bite. So we are going to take the 3 to 4 bites, and after taking the bite we'll put this wire loop and we'll pull it outside, and through outside we are going to put the fiber tape and try to settling so that fiber tape will pass all around the rotator cuff, and then both fiber wire we are going to take out through the anterolateral portal, and then we are going to take another bite, and consecutively we'll take as many as want to proper holding of the rotator cuff. And after that 2 suture fiber we are going to take through the, and in the same pattern we are going to pass the fiber loop and then followed by the suture thread, and then I'll put the 2 thread to the anterolateral portal, and then it will take in the lateral portal to make the sliding knot SMC, and you can see from outside. And after this we are going to put some couple of half hitches, and you can see this. Just make sure that knot should be properly placed over the supraspinatus with the knot piecer, and then put some few half hitches to secure the knot. And same pattern we are going to follow for the other 2 suture. And then this is for the second knot, and these 2 threads now I'm going to secure with the lateral row with the peak suture after putting the knot. And here I'm going to put the 2.7 mm knotless suture anchor directly after punch, and you can see this is the thread is now properly secured in the place, and this is the double row repair of the rotator cuff. Now I'm going to put another more suture to secure the other 2 thread. and this is the final fixation, and then we'll cut the thread with the suture cutter, and this is the final picture after the repair. And you can check the stability by moving your humeral head. And thank you for watching this video.